Welcome to On the Beat. Today I am joined by Dr. Siddharth Reddy, and he is with the Columbus Cardiology Care with Baptist Medical Group. And Dr. Reddy, we are talking about a condition I don't think a lot of people know about, peripheral artery disease.
Yes. Thank you, Karyn, for having me.
Yeah.
Yeah, peripheral artery disease is blockage in the arteries that supply the legs, the arms, just anywhere besides the heart. It's a relatively common disease, but goes unnoticed.
And why does it go unnoticed?
So it goes unnoticed because a lot of people think like old age or something else is causing them troubles. They can feel weakness in their legs, cramping, tingling in their legs, or just have injuries and wounds that don't heal in the legs, and they chalk it up to old age. And that's not always the case.
Okay. And what ages do you typically see it?
So peripheral arterial disease usually begins around in their 40s and goes all the way up until kind of the end of life. Similar to heart disease, there's very similar risk factors. So high blood pressure, cholesterol, diabetes, just sedentary lifestyle. These are all risk factors for it, and it usually doesn't get screened as much as coronary artery disease or these other diseases.
So how do you screen for it?
Yeah, so screening for it, in the office, we usually just ask simple questions like, hey, how far can you walk? Do you have pain in your legs when you're walking? Have you noticed that you've gotten injuries in your legs that are not healing? And if they answer yes to these questions, or they have risk factors for it, then we do screening tests. And screening tests include, as simple as in the office, we can check a blood pressure in the arm and a blood pressure in the leg. If they're off, it could be peripheral arterial disease. To more advanced stuff like CT scans, where we can look at the flow in the arteries, or ultrasounds, where we can measure blood flow down the vessels.
And a lot of the symptoms that you just mentioned seem like they could be symptoms for other conditions as well.
Yeah, so absolutely. So the same risk factors are for heart disease, stroke, diabetes, high blood pressure. These are all risk factors, and we just need to check and keep an eye on what's happening with these.
So they come to your clinic and they realize they do have this condition. What is the next step?
Yeah, so the next step, there's always multiple options, but we try to do conservative management first, and that's getting you on the right medications, making sure you're eating right, getting all your other diseases under control, like diabetes, cholesterol, blood pressure. If we get those under control, that'll also help. And most importantly is staying active, exercising. Even if it's just walking around the block a couple times will go a long way. And if those aren't helping or those aren't working, we do more invasive procedures, which is ballooning and stenting to open up arteries, or even if we can't do that, we can do bypass surgery as well.
So a lot of treatments, and so a lot of great things that can be done if you have this condition and not be suffering from it.
Absolutely.
Okay. And what would be your last bit of advice for somebody of any age that's feeling those symptoms? To make a call?
Yeah, absolutely. If you're feeling these symptoms, you can give our office a call. You can talk with your primary care provider, and they can kind of get the process started and get all the screening done. And absolutely, if you have it, we're happy to see you and help you out.
Great, because I know it's one of those conditions you wouldn't think about, so we're so thankful that you were here to tell us about something I wasn't very familiar with as well.
Oh, absolutely.
Yes, thank you so much for being here. And if you would like to get more information or ask the doctors any questions, if you look at your screen at the end of this segment, we will have the website and phone number for you. Thank you, Dr. Siddharth Reddy, for being with us today, and we will see you again on The Beat.